Good evening and welcome to the discussion on temporal bone part 4, Dr.Smell-Bell-Verbal, India. Today we are going to have the parts of the temporal bone, of which we are going to discuss about the squamous part. Squamous part, it was the mastoid part, and this is the squamous part. This is the zygomatic portion, so zygomatic process, and this is the styloid process, and this particular one which is projecting towards this side is called as the petrous part. This is the petrous apex. As you could see, squamous part is a membrane or investing or dermal bone. It is a membrane or investing or dermal bone. It is just like a plate shaped, as it covers the temporal lobe of the brain. If this were to be my squamous part, it would have been like this. So this particular part covers the particular temporal lobe of the brain. So if we take as it is, this forms the anterior part of the temporal bone and upper part, these being the lower part. These are all the lower part which I am showing with my ring finger, and this one is the anterior and the upper part as it is. It has got two surfaces, external temporal surface and internal is the cerebral surface. External temporal surface and internal is the cerebral surfaces. Two borders, superior border and anterior inferior border. So this is the superior border which I am showing with my index finger, and anterior inferior border. One process which is called as zygomatic process. You are able to see the zygomatic process which is projecting anteriorly. And one fossa called as the mandibular fossa. This is the mandibular fossa, partly constituted by this squamous part which I am showing with my ring finger. This is the squamous part of the mandibular fossa, and this is the tympanic bone. The tympanic bone is also forming the mandibular fossa, wherein the head of the mandible is sitting over here, like this part. This particular thing, head of the mandible is articulating like a temporomandibular joint. So in this particular lecture we discuss about the external temporal surface and internal cerebral surface. This is the external temporal surface, has got 11 points to be seen over here. 11 points to be seen over here. Number 1 is the temporalis muscle origin. The temporalis muscle origin, this is the temporalis muscle region, origin of the temporalis muscle from whole of the external surface, excepting the zygomatic process and mandibular fossa. So wherever the space is available here on the squamous part, completely occupied by the temporalis muscle, upon which is covered by the temporalis fascia. Temporalis fascia, as we can take a part of this temporalis fascia and put a graft on here. Take a temporalis fascia here and put a graft here. Number 2 is groove for middle temporal vessels. Groove for middle temporal vessels, it will be just above the opening of the external auditory canal. Just above the opening of the external, if you think this is the external auditory canal, this will be the groove for the middle temporal, just above the opening of the external auditory canal. So groove for the middle temporal, this is a groove for the middle temporal vessel just above the external auditory canal. And third one is the supramastoid crust. Supramastoid crust runs just above this opening of the external auditory canal, runs above the opening of the external auditory canal. It's a curved ridge or line running upwards and backwards from above the anterior part of the external auditory canal. So from here it starts running upwards and backwards above the external auditory meatus and gives attachment to the temporalis fascia. So this temporalis muscle has got temporalis fascia, has got attachment over here and forms the posterior limit of the temporal fossa. So this is the supramastoid crust which you are able to see. Number 4 is the squamomastoid suture. So this is the mastoid process and this is the squamous part. So squamomastoid suture you should be able to see over here. Squamomastoid suture, remember by SMS. Supramastoid crust and squamomastoid suture. So squamomastoid, so this is the mastoid bone and this is the squamous part of the temporal bone, squamomastoid suture, as you could see over here in this. Of course it needs a microscope to be seen. Just squamomastoid suture. So this particular squamomastoid suture lies 1.25 centimeters below and behind the supramastoid crust. If this is the supramastoid crust just running backwards from above the external auditory canal to backwards. So this squamomastoid suture lies 1.25 centimeters below it. So it indicates the line of fusion of this squamous part and this is the mastoid part, squamous part and the mastoid part. Number 5 is auricularis posterior muscle. As you could see that I am able to move my pinna. With little effort. This is because of the auricularis posterior muscle, which is originating between the supramastoid crust and squamomastoid suture. Supramastoid crust is landing above the external artery canal posteriorly till the mastoid process, and squamomastoid suture, as you know, 1.25 cm below it. So supramastoid crust and squamomastoid suture, there will be the auricularis posterior muscle, APM, auricularis posterior muscle. Next, 7th one is the most important, suprameatal triangle, McEwan's triangle. As we see, McEwan's triangle is boundary for the mastoid antrum. So this forms the spine of Henle. As you could see, this particular projecting part is called as the spine of Henle, and McEwan's triangle is just below the supramastoid crust. Below the supramastoid crust, you can see the McEwan's triangle. This McEwan's triangle is at the anterior end of the supramastoid crust. So anterior end, this is supramastoid crust. If you can see, anterior end of supramastoid crust and above the EAC. This is just posterior superior part of the EAC. If this is the EAC where I am putting my middle finger, this is the EAC which I am showing over here. This is the EAC, and posterior superior, if you go here, so just below this particular supramastoid crust, anterior to the supramastoid, anterior inferior to the supramastoid crust, and posterior sector of the EAC. Posterior sector of the EAC. As you could see over here, if you can just mark it as simple as that, and this would be the spine of Henle. As you could see, this is the posterior superior part of the external artery canal. This is the posterior superior part of the external artery canal. So this is the supramastoid crust. Supramastoid crust is standing above the external artery canal, supramastoid crust, and this is the squamomastoid suture, as you could see. So this is the posterior superior part. If this is the EAC, this is the anterior, this is the posterior. Posterior superior part of the EAC, you draw a line like this, and this is anterior inferior part of the supramastoid crust, and a tangent drawn along the posterior border of the EAC, and a tangent drawn along the posterior border of the EAC, tangent drawn along the posterior border of the EAC. These three form something called as McEwan's triangle, which is a boundary for mastoid antrum, the largest air cell, which is nearly 1.25 centimeters. If we start drilling here 1.25 centimeters, it will be the mastoid antrum. So if you can see, supramastoid crust, anterior to supramastoid crust, and posterior part of the EAC, you are drawing a tangent, and posterior superior part, you are drawing a line like this. This triangle is going to form the McEwan's triangle. Suprameatal spine, a small bony projection anterior to the suprameatal triangle. If you take this is a suprameatal triangle, anterior to suprameatal triangle is a suprameatal spine. That is spine of Henle, as you can see over here. It is an inconsistent landmark for mastoid antrum. So next, 8th part is the zygomatic process. This zygomatic process is there in the anterior and inferior part. This is the inferior part of the temporal bone, runs horizontally, laterally and anteriorly. HLA, horizontally, laterally and anteriorly. This anterior part articulates with the zygomatic process of the temporal bone, articulates with the zygomatic bone and forms the zygomatic arch. Just in front, here will be the zygomatic process and here will be the zygomatic bone. They form the zygomatic arch like this here at this point. This zygomatic process has got two parts, that is anterior part and posterior part. My little finger is showing the anterior part here and this is the posterior part. Junction of this will be here. So anterior part is thin and posterior part is thick. Two surfaces, that is lateral surface and the medial surface. Medial surface. This is the lateral surface which I am showing with the little finger, and this is the medial surface. Two borders, superior border and inferior border. Superior border and inferior border. Anterior and posterior end. Anterior end and posterior end. So anterior end articulates with this particular zygomatic bone. This is the zygomatic process of the temporal bone, articulates with the zygomatic bone. And posteriorly it is attached to the particular squamous part of the temporal bone. And this is the medial part and this is the lateral part, superior and inferior border. Two surfaces are, lateral is convex and subcutaneous. This is the convex and subcutaneous part of this particular convex, and just in front of the EAC, that is in front of the EAC will be the zygomatic process. So lateral will be subcutaneous and medial part will be giving rise to origin of masseter muscle. Medial part, as I am showing with my ring finger, medial part is giving rise to origin of masseter muscle. You could see the clenching of the masseter muscle when we are trying to chew the food. So closure of the mouth, masseter muscle, along with medial pterygoid and masseter, and the two borders are superior border and inferior border. Superior border gives attachment to the temporalis fascia. Superior border gives attachment temporalis fascia. Temporalis muscle will be here. Temporalis fascia will be attached over here. As you could see, the temporalis fascia is attached from here. Middle finger is showing from here to here to here to here. And this part, this is supramastoid crust, which is giving rise to origin of this particular temporalis fascia. And inferiorly it gives rise to origin of masseter muscle. As it is written over here, it is masseter muscle that is originating from the inferior border. So these are the parts of the anterior part of the zygomatic bone, and posterior part is thick and triangular. Anterior part is thin and flat, posterior part is thick and triangular. As you could see, thick and triangular. It attaches with the squamous part of the temporal bone. So it has got three borders. It has got base, which is fused with the squamous part of the temporal bone, anterior part and posterior border. Anterior border and posterior border. Base is fused with the squamous temporal bone, as showing with the middle finger. Anterior part constitutes the anterior root of the process, posterior part constitutes the posterior root of the process, and base is attached to the squamous part of the temporal bone. Anterior part, posterior part, and this is the base that is attached to the squamous part. This anterior root and posterior root meet together at a point called anterior root and the posterior root, and this is the base. So posterior part has got anterior root, posterior root, and then base. These two roots meet at a point called as tubercle of root of zygoma, which gives attachment to the lateral ligament of temporomandibular joint. This is the temporomandibular joint. You are able to open. Lateral ligament of temporomandibular joint is found from the junction of anterior and posterior part of the zygomatic process. So it forms the lateral root of this particular temporomandibular joint, and which is giving rise to a ligament here at this point. Tubercle of root of zygoma. So at this particular tubercle, you can see that this posterior root is continuous. So this base is attached to this squamous part. This posterior root, which I am showing right now with the middle finger, is going backwards, and then it is joining the supramastoid crust. This posterior root is continuous with the supramastoid crust, and this posterior root is in front continuing with the upper part of the zygomatic bone. In front continuing with the zygomatic bone. If you take the surfaces, this is the superior surface and this is the inferior surface. So this superior surface is just concave and continuous with the temporal surface. This is concave and continuous with the temporal surface. The inferior surface is convex and mostly occupied. This is the temporomandibular joint region, and my middle finger is showing the temporomandibular joint. In front will be this particular occupied by the inferior surface of the anterior part, which is in front of the mandibular fossa. It is called as articular tubercle. Articular tubercle is articulates with the articular disc. This is the articular tubercle of the which articulates with the articular disc of the temporomandibular joint. The mandible is in this particular position where I am putting my middle finger. This is the mandible. If you take the posterior border inferior part, which is the articular tubercle, it is just the roof of the infratemporal fossa. This is just the roof of the infratemporal fossa. This forms the roof of the infratemporal fossa, continuous with the anterior root of zygoma, in front with the infratemporal crust of the greater wing of sphenoid. So if it is medially, it is going to the infratemporal crust of the greater wing of sphenoid. So it forms the roof of the infratemporal fossa. There is something called as number 10 will be the squamosal foramen, which is in front of the anterior root of the zygomatic process. So anterior root of zygomatic process, something called as squamosal foramen at this region. If it is present, it transmits the petrosquamous sinus. Squamosal foramen. Squamosal foramen is rarely present just above the anterior root of the zygomatic process. Anterior root of the zygomatic process. And if it is present, it transmits the petrosquamous sinus. Next is the mandibular fossa. Mandibular fossa. If you take this mandibular fossa, next 11th part is mandibular fossa. It is formed by the squamous part and partly by the tympanic part. This is the tympanic part. If this is the external artery canal, this is the tympanic part, and this particular part is the squamous part of the particular temporal bone. It possesses two parts. That is, this mandibular fossa has got anterior, which is articular part, and posterior is non-articular part. This anterior part is articular part and posterior part is non-articular part. Anterior articular part is formed by squamous part, which is smooth, as you were able to see over here. It is smooth, oval and deeply concave, bounded in front by the articular tubercle. As we have seen, this is the articular tubercle of the zygomatic process. This is the articular tubercle of the zygomatic process. In front of this articular part is having the articular tubercle of the zygomatic process, and then it articulates with the articular disc of the temporomandibular joint. So its articulated with the articular disc will be over here. and posterior is the non-articular part. This is the anterior part, this is the posterior part. Posterior part is the non-articular part, and it contains a portion of the parotid salivary gland. Parotid, as it is seen, parotid gland is over here. It runs towards here. Parotid salivary gland is present in the non-articular part of the stem, this particular mandibular fossa, and it presents, this particular mandibular fossa presents the postglenoid tubercle, squamotympanic fissure and petrotympanic fissure. Postglenoid tubercle, squamotympanic fissure and petrotympanic fissure. This particular mandibular fossa has got postglenoid tubercle. What is postglenoid tubercle? That is the one which is separating the articular part and non-articular part. Articular part and non-articular. If it is present, it will be present over here, and it is called as third root of zygoma. Articular part, non-articular part. If it is something is present here, it is called as third root of zygoma. It is called as postglenoid tubercle, or also called as the third root of the zygomatic process. So 1, 2, 3. This is the third root of zygomatic process. So this mandibular fossa has got, so postglenoid tubercle is number 1, and number 2 is ST fissure. What is ST fissure? Squamotympanic fissure. This is the squamous part, and this is the tympanic bone. Squamotympanic fissure. This is the squamotympanic fissure. Squamotympanic fissure. Squamous part and tympanic part. This squamous tympanic fissure, squamotympanic fissure. This squamotympanic fissure is also added upon by the downturned anterolateral part of the tegment tympani. So if this is a tegment tympani, it is coming down and then reaching over here, downturned anterolateral part of the tegment tympani, and it divides into two parts. Downturned anterolateral part of the tegment tympani, it divides into two parts. Number 1 is petrotympanic fissure. Petrotympanic, of course it is very difficult to see over here. Number 1 is petrotympanic fissure and petrosquamous fissure. Petrotympanic, that is between P and T. Petrosquamous, that is between P and S. Petrotympanic fissure and petrosquamous fissure. Petrosquamous fissure transmits no structure. Petrosquamous, that is PS, transmits no structure. Petrotympanic fissure between tegment tympani and tympanic part. It communicates with the tympanic cavity, that is middle ear, lodges the anterior ligament of the malleus. Petrotympanic fissure lodges the anterior ligament of the malleus, and it transmits the atama, that is anterior tympanic artery of maxillary artery, to the middle ear. At its medial end, there is an opening for anterior canalicus for chorda tympani to exit from the middle ear. At this anterior end, it is difficult to show in this, but it is a microscopic thing. So petrotympanic fissure has got atma and anterior canalicus, atma and anterior canalicus, atma and anterior canalicus, atma and AC, anterior canalicus for chorda tympani nerve to exit from the middle ear. And this petrotympanic fissure also has got anterior ligament of the malleus. Now it is the internal cerebral surface, which is having a lot of things to be dealt over here. It is concave and has got grooves for the particular cerebrum, that is temporal lobe of the brain. So it has got impression for the middle meningeal vessels, middle meningeal artery, and petrosquamosal suture, which is present inferiorly where the cerebral part of the squamous part unites with the petrous part. So this is the squamous part, this is the petrous part. This is the petrosquamosal suture, and petrosquamosal sinus. It is present close to the site of union of cerebral part of the squamous part and petrous part of the temporal bone, which lodges the petrosquamosal sinus. Here will be the petrosquamosal. Just above will be the petrosquamosal suture, and here will be the petrosquamosal sinus. If you take the borders, the superior border of the squamous part, it articulates with the parietal temporal bone, forms the squamosal suture. Superior border of the particular squamous part articulates with the parietal bone, forms the squamosal suture. This is the superior border and this is the anterior-inferior border. This anterior-inferior border articulates with the greater wing of sphenoid. So here will be the parietal bone articulation, here will be the greater wing of sphenoid articulation. So this completes the basic understanding of squamous part of the temporal bone, which has got nearly 11 parts. That is, the first one is origin of temporalis muscle, and then middle temporal vessels which enter here, middle temporal vessels, and then supramastoid crust and squamomastoid suture, supramastoid crust, squamomastoid suture, origin of auricularis posterior muscle, suprameatal triangle, that is the McEwan's triangle, and the suprameatal spine, SMS, that is the spine of Henle. Eighth part is the zygomatic process, which you are able to see here. Ninth part is a small triangular area in front of the articular tubercle, which forms the roof of the infratemporal fossa. 10th one is the Squamosal Foramen. 10th one is the Squamosal Foramen. 11th is the Mandibular Fossa. 11th is the Mandibular Fossa, which consists of post-clinoid tubercle, and then squamotympanic fissure. Squamotympanic fissure has got petrotympanic fissure, which is number 1, and petrosquamous fissure. Petrotympanic fissure and petrosquamous fissure. And it has got internal cerebral surface with a lot of grooves, petrosquamosal suture and petrosquamosal sulcus. Borders like superior border and anterior-inferior border. Superior border with the parietal bone, anterior-inferior border with the sphenoid bone, greater wing of sphenoid. This completes the part 4, that is the part of squamous temporal bone, which is the most important and most robust one. And next part includes the petrous part of the temporal bone, which completes the whole of the temporal bone, understanding basic anatomy. These are all not microscopically understood. You need microscopic anatomy separately. So for that reason, this is just a macro anatomy combined with the microscopic anatomy. Thank you very much for watching Smell-Bell-Verbal Cervical Surgical Anatomy of Temporal Bone videos. Like.